Hi, this is Dr. Tom, and today we're going to talk about shoulder pain. People live with shoulder pain for a lot longer than they have to, and it seems to be one of those things that people just kind of resign themselves to, well, eventually I'm going to need surgery to clean it up or fix it, and I'm just going to kind of wait until that time because maybe you've tried some things in the past and they haven't quite worked out. Maybe physical therapy is one of those things and you had the experience where you were just given the same 15 exercises that every other person with shoulder pain was given in the clinic, and then some kid who had just graduated high school and thought they might want to be a physical therapist someday was coming around and telling each person what exercise to do next. You might have also tried taking painkillers at some point or anti-inflammatory medications. You've probably had a trip to the MD and then they tell you to go get x-rays that come back inconclusive, and eventually you may find your way to an MRI where they'll look for something that they can point a finger at and say is causing your pain. The fact of the matter is that when somebody first starts to get shoulder pain, unless there's an acute injury where they fall on that shoulder or fall on an outstretched hand, the issue is more of something that happens over time. It's called a degenerative issue. So you have a degenerative rotator cuff tear or an AC joint issue, and what causes that is the way that you have been moving habitually over the past few years. There might be some imbalances now in the muscles in the front versus the muscles in the back, and what you truly need is an expert to guide you through which exercises to do at which phase of treatment to not only get you out of this phase of pain, but make sure that that pain does not come back for a prolonged period of time, and that if it ever does, you understand exactly what you need to do in order to keep it from coming back. That way you can enjoy throwing the ball with your kids, or lifting weights overhead, or doing whatever else, like sleeping on one side without having to wake up to turn over to the other side because of your shoulder pain, right? So a lot of people give up one thing at a time until they have nothing left and they're thinking that surgery is their last result, but they really want to avoid surgery, and that's what the Doctors of Physical Therapy is for. We are for people who are serious about getting their shoulders back to optimal health by committing to doing the right exercises at the right time under the guidance of an expert. We spend an hour one-on-one with every single one of our patients. We do not use any aids or texts so that we make sure that you understand why you're doing everything that you're doing at each phase of your program and how that's going to contribute to you getting better over the long term and not regressing back into that pain state. If that sounds like something you're interested in, you can read below on the webpage to find out more about our approach, even more about why the things that you've tried in the past haven't worked, and then you can decide for yourself if you'd like to fill out a contact form or an inquiry form so that we can get in touch with you for either a consultation, or if you're ready to get started, we can help you schedule a full evaluation. You can always give us a call at the number located at the top of the page. The longer you wait, the longer this issue is going to keep happening, and unless you fix the movements that cause this issue in the first place, the issue may even come back after some sort of surgical intervention. So if you're ready to get started, like I said, please click the form, send us an email, or call us today to get started, and we can help you get back to living your life today.